Have you ever heard of a birth defect that affects a baby right from the mother's womb just after conception? Well, there is something called the neural tube, which make up the brain and the spinal cord in a developing embryo, which usually forms and close after 28 days of conception. In case this tube does not close properly, it will result to what is known as a spina bifida. In this case, you will see a fluid-filled sac-like object at the lower or middle back of the baby. There are various types of birth defect which can affect a baby in the mother's womb and after birth, which is why it is advisable as a woman to take good care of your body in preparation for pregnancy and delivery. A little tip here: pregnancy and childbirth comes with a lot, which is why you should take your antenatal and postnatal care very important. Let us properly define spina bifida. Spina bifida is a neural tube defect. That means it happens when the spine and spinal cord don't form properly in the womb. It occurs during the first month of pregnancy, often before a woman even knows she's pregnant. In spina bifida, a portion of the neural tube doesn't close completely, leaving part of the spinal cord exposed. This can lead to nerve damage and varying levels of disability. The severity depends on the type and location of the defect on the spine. Let's explore the types. Welcome back to Nursing Health and Lifestyle, where you get all tips to health and a healthy living. Types of spina bifida. There are three main types of spina bifida. Spina bifida occulta. This is the mildest form. There's a small gap in the spine, but no opening or sac. Most people don't even know they have it, unless it's found on an X-ray. Meningocele. A rare type where the protective membranes around the spinal cord push out through the opening in the spine. Surgery can often fix it, and nerve damage is usually minimal. Myelomeningocele. This is the most severe form. The spinal cord and nerves are exposed through an opening in the back. It can lead to serious disabilities, like paralysis, bladder and bowel issues, and learning difficulties. Causes and risk factors. The exact cause of spina bifida is unknown, but several factors can increase the risk. Low folic acid intake before and during early pregnancy. Family history of neural tube defects, diabetes in the mother. Certain medications, like anti-seizure drugs. Obesity during pregnancy. That's why folic acid supplementation is so important to women before conception, and the first few months of conception prevention and prenatal care. Spina bifida can't always be prevented, but the risk can be greatly reduced. Experts recommend that women who can become pregnant take at least 400 micrograms of folic acid daily, starting before conception and continuing through early pregnancy. Also important are healthy eating, managing diabetes, avoiding harmful medications, getting early prenatal care. Spina bifida is often detected during pregnancy through ultrasound or blood tests. Treatment and management? Treatment depends on how severe the condition is. Some babies may need surgery shortly after birth to close the opening. Others may need multiple surgeries throughout life. Care may involve physical therapy for mobility, bladder and bowel management, assistive devices like braces or wheelchairs, special education support, a team of specialists. Pediatricians, neurologists, therapists and nurses work together to give the child the best quality of life possible. Many people with spina bifida go on to live happy, productive lives. With proper care, support and education, children can thrive, go to school, and even grow into independent adults. Spina bifida may be a lifelong condition, but it doesn't have to define anyone's life. Tips. Folic acid plays a critical role during pregnancy, especially in the early stages. Here are the key functions of folic acid for pregnant women. Prevents neural tube defects, NTDs. Folic acid helps in the formation of the neural tube, which develops into the baby's brain and spinal cord. It significantly reduces the risk of serious birth defects, like spina bifida and anencephaly. Reduces risk of preterm birth and low birth weight. Adequate folic acid intake is linked to a lower risk of premature delivery, low birth weight and miscarriage. Supports maternal health. It helps the mother's body make more red blood cells, reducing the risk of anemia during pregnancy. Ideally, folic acid should be taken before conception and during the first trimester. Live healthy and have a healthy baby. Thanks for watching. If you found this video helpful, don't forget to like, subscribe and share. And drop a comment if you have questions or want us to cover another health topic. Stay healthy, stay informed, here on Nursing Health and Lifestyle.